Good afternoon and welcome. Thank you to all of you who are here with me, and to those of you who could not be here, a video will be posted either later today or Monday for all those who could not attend, so that we all get exactly the same message. That's my goal. My goal with the State of the Agency address is to bring as many staff together at the same time in the same room and talk about the current status and the future direction of the Will County Health Department. I could have attended 5 different divisional staff meetings. A lot of times around here, that's how we do things. But one of my goals is to unsilo the agency a little bit by little bit. And so this is one way of doing that. Although the divisions provide some very different services, I know they all have the same overall goal: service, dedication, and adherence to our mission. So I'd like to take a few minutes to revisit 2016. I started this position on February 1st, and I will say my first few months were very challenging. I experienced situations that some administrators never see in their entire career. But that's okay. They were opportunities for me for growth and for learning, and I take advantage of that. I'm thankful for that. What the agency experienced was very difficult. Yet another downsizing in May affecting 55 positions. The state of Illinois was not paying us for the programs we were contracted to do, and therefore we faced a large revenue deficit. With uncertainty about whether or not we would be paid, how much, or at all, it was necessary to mitigate the loss of revenue with a combination of program eliminations, several holds on recruitment throughout the whole entire agency, a moratorium on spending. We bought only mission critical items. I'm sure some of you were involved with that. I need this. You can't have it. Do you really need it? And we paid our contractually obligated services, but we were able to mitigate the revenue deficit. The county also assisted us with a loan to help us with cash flow. And finally, in October and November, payments came from the state, and we ended the year with a decent cash balance. I know that was an extremely difficult time for the agency. I assure you that mitigation measures like these are not taken lightly. The leadership team and I know it is very disruptive, counterproductive, and above all, emotionally unsettling for all affected, as well as for our clients, customers, and patients. Everyone feels the impact. I hope this is something we can truly avoid in the future. But 2016 brought us some great things too. We made some headway and some accomplishments within the agency. Administration, we were able to add an additional guard at the front desk for some increased security. Administration also recommended to our Board of Health and received approval for a 2.5% increase for all exempt staff, a well-deserved increase that does not come automatically. I appreciate the Board of Health support for this and thank the exempt staff and managers for being patient and dedicated. EP&R has a new coordinator, Katie Weber. Where are you, Katie? There you are. Well, who came to us with several years of experience in emergency response, and just prior to her hire in this coordinator role as our emergency preparedness specialist. Katie and her team of 2 do a great job. Environmental health, in 2016, they fully implemented Envision Connect Remote. You'll be glad to know that our sanitarians now conduct food inspections on tablets in real time. They updated their food, sewage, and water codes. They started their Victory Wall in Flat Stanley. And if you want to know what that is, ask anybody in environmental health, they can tell you. The laboratory again passed their NELAC lab certification with flying colors. They analyzed 2,500 more samples in the lab than they did the previous year. In behavioral health, we transitioned the adult psychiatric clients to the community health center. We receive a much higher payment for these services through the federal grant at the community health center. This is one measure of sustaining the revenue. They began to expand the electronic billing system to include an electronic charting system. They began a group intake approach to streamline the process and start clients in treatment sooner. In the community health center, they exceeded their target for patient visits in 2016. They expanded their services to fully integrate behavioral and primary health care. They accomplished many goals in their strategic plan. They worked feverishly to prepare for their upcoming Joint Commission accreditation survey. They started a teen clinic to increase the outreach to teens regarding HIV, STIs, and family planning. In family health services, they restructured their WIC and family case management visits to streamline the process and concentrate on high-risk cases. Through the chronic disease grant, they facilitated a total nutrition policy at Silver Cross Hospital that will have a positive effect on their entire staff. They passed 2 tobacco-free park ordinances, and they serviced close to 3,000 walk-ins in the immunization clinic alone. They also worked with schools in the Valley View School District in developing curriculum for the students as part of the Teen Pregnancy Prevention Grant. We did a lot. Even with all that going on, we did a lot. So many of our initiatives cut across fiscal years. So let's talk a little bit about what our initiatives are and what's coming up in 2017. Well, in 2017, administration, we added a new division director, Director of Administrative Services, Elizabeth Bellata. There she's back there. Elizabeth came from environmental health. She's a 21-year veteran of the health department. She's doing a great job. She's taking on many of my past responsibilities, and she has a lot of great ideas for future initiatives. HR is finishing the Kronos conversion that will roll out next month. We are conducting the first strategic planning process for the department. ITT is implementing Office 365. That's going to provide us with a lot of great things technologically. We have a new media services manager, Steve Brandy. Steve comes with a couple of decades of media experience. He's going to expand our media coverage. So you've probably seen it already. We've got a lot more impact in local papers and in media. He's going to enhance the media coverage, the website, and the social media programs, and he's also doing a great job so far. We're also working with our landlord at the North Branch office to update that office. It needs some TLC. And we're also going to begin upgrading our cameras here at the 501 Ella office. EP&R is working hard on maintaining our required NIMS training, our required drills, keeping our medical reserve corps ready and engaged, and working with our county partners to update the plan. That all sounds a lot easier than it is. Environmental health has a new director as well, new division director, Tom Casey, right here. Tom, who was previously an environmental health coordinator at our Northern Branch office. Tom comes to this position with 28 years of experience at the health department, 24 years of management experience here, and he's doing a great job as well. Environmental health is also making preparations to change the food establishment enforcement to model the FDA food code. That's no small feat. That's a big change in how they conduct inspections. They're looking to adjust to 2 new technologies in private sewage. These 2 systems were just recently approved by Illinois Department of Public Health. So all of that takes a lot of changes within ordinances and training and lots of things. Behavioral health, we are now providing much needed training to the new deputies, the new county new county deputies regarding behavioral health, things that, skills that they're going to need in the field for behavioral health issues. We're looking forward to another CARF and APA accreditation. I don't know about looking forward to, right, Armando? But it's all good things. Also, behavioral health was contracted once again to provide services to our county court system and the county sheriff's department. They went out for bid for that this past year, and we were awarded that bid. In the community health center, they're continuing to expand services. We're looking at increasing or putting psychiatric services at the Northern Branch office and Ella Avenue, and expanding the teen clinic that now occurs, just changing to Monday nights, at NBO as well. That's going to coincide well with our teen pregnancy and prevention program and family health services. We're also going to look at the feasibility of delivering our community health center patients' babies at Provena St. Joe's Medical Center instead of just Silver Cross Hospital. We want to be able to provide our patients there with a choice, something we haven't done in the past. We've worked on that a couple of different times. It just didn't work out. We're going to try it again. We're also going out for bid for a security camera system for inside and outside the community health center building, so it covers that campus. Health Center is also looking to add a diabetes education group and a group counseling on addictions, and of course, adding any other favorable collaborations with our community partners. Family Health Services in 2017 will continue to service the more than 7,500 families in their WIC program. They have increased their cross-training of staff to accommodate a over 20% increase in STIs in the county. That's real consistent with the state average, so they're working hard to do that. MAP has completed the cycle of assessments. It's actually our third complete cycle for MAP, and they're continuing to get the word out on some of our very successful initiatives and campaigns. One is Nowhere to Go, and the other one is Rethink Your Drink. And they're also finding ways to address the stigma around mental health and addiction issues. Okay, let's talk a little bit about finances and budget. Finances drive organizations, and our agency is no different. I'd like to share with you some facts and figures regarding the budget. The total agency budget this year is $28,023,221. It's about a 4.5% decrease from last year. This year, I funded positions at 100% instead of 97%. As long as we receive the proposed revenue and our funders do not eliminate programs, we should end the year just fine with no cuts. 83% of our budget, or roughly $4.7 million, 83% of our expenses is all salary and fringe. So whenever we have to cut expenses, unfortunately, it comes in the form of jobs. We spend only 17%, or roughly $4.7 million, on supplies, commodities, our contractual arrangements, campus costs such as gas, electric, snow plowing, those maintenance costs. And so, like I said, unfortunately, if we have to cut expenses and we have to make deep cuts, it comes in the form of jobs. But I'm really hoping to not have to do that this year. So, some of my goals and initiatives for 2017. Initially, they involve revenue. And I'd like to try a different approach to maximizing our revenue. I've established a new grant policy to better monitor and vet the funding opportunities. We're going to maximize our staffing levels, and we're going to maximize our cross-training. That should help us with efficiency. That will also maximize our productivity, which should maximize our billing, which should maximize our revenue. If everybody does their piece, this should work. So, revenue-generating positions will be filled as a priority. Productivity is everybody's responsibility. Management is being asked to address the gaps in productivity, and we all need to work as a cohesive team. Some other initiatives in the works, as I mentioned before, our inaugural strategic planning process. I'm very much looking forward to this to bring our agency together and rowing all in the same direction. Many of you participated in the surveys early on in the process, and I very much appreciated that. Right now, we are conducting interviews for our facilitator to help us with the active planning portion, and soon we will be scheduling to do that. Many of you also volunteered to participate in the active planning process. Again, thank you. That was very positive. And once we choose our facilitator, we look at a timeline, and we look at the other stakeholders to participate. We will then be reaching out to you for your participation. I'm also working with both the County Legislative and Policy Committee and the Northern Illinois Public Health Consortium on increased advocacy. Historically, public health has not been very vocal in demanding increased funding or funding in general. We have many unfunded mandates and grants whose funding has not increased in decades, yet we are serving more clients and doing more requirements under the grant. By working with these two entities, I hope to increase awareness and advocacy for what we and public health does in general. At the state level, I've asked the county committee to support an increase in the funding for the local health protection grant. That's funding for our core programs. And at the federal level, increased funding for the community health center. It has not yet been decided, but Mary Maragos and I may take a trip to Washington, D.C. next month to advocate for funding for the community health centers, money for expanded services, and also to make legislators aware about the very positive effect the expanded Medicaid has had on our agency programs and the entire community. Lastly, we have some wonderful news regarding a replacement health department building. It's hard for me to talk about it without smiling. Right now, the RFQ is out and it's advertised. It's due January 30th. A selection committee has been chosen by the county board, and of course, I and a member of the Board of Health will sit on that selection committee. Once the architect and engineering vendor is chosen, we will begin working on the design of the building. I've been asking the health department leadership team for their input, and we are looking at about a 14-month design phase. We've begun to look at designs at other health departments and public buildings to get some ideas and feedback on what we should do and what we shouldn't do. Yesterday, myself and Elizabeth and Pat Thorne visited Kendall County Health Department and received a lot of good feedback from them. And we'll be making other visits to other public buildings. Any and all suggestions will be heard, and we will most likely send out something via SurveyMonkey to get some feedback from all of you. I've received some ideas from you already. Some of you have emailed me, and they're good ideas. And you know, you deal with the public, you deal with your clients and customers and patients. So it's a good chance you know what's necessary, what's needed, what's asked for. So I want to hear about that. I'd like to thank our Board of Health for their support and their engagement. Thank you to our managers for the extra mile they always go, and the staff for all you do. I truly believe that every one of us holds an important job in this agency. Without all of us working together, our clients, patients, and customers would not have nearly the level of services that they do. I have witnessed firsthand the competency, compassion, and dedication many of you bring with you to work every day. And it shows in our accomplishments and the many model programs that we have. We need to continue to hold ourselves accountable. Our clients, patients, and customers expect and deserve it. Thank you for your attendance, and I hope we have a wonderful 2017. Have any questions? Really? Wow. Okay. Yes, Steve.
I don't ask.
Of course, it's the media guy. You know?
Strategic planning process. This is something new. Can you explain, maybe in a layman's terms, what does that bring to the table that's never been there before?
Okay. So in public health, we are supposed to be driven by 3 core requirements and 10 essential services. That's what local public health departments are supposed to do. And when you have a process whereby you look at what are we doing, what are we supposed to be doing, what can we afford to be doing, all of that is able to become much clearer. We've not done that in the past. We've done strategic planning through MAP, and that's concerning the whole public health system in the county. We need to concentrate just on our agency. And so that's what I'm hoping to do. Work with a consultant, work with some of you, some Board of Health members, some of our managers, our steering committee, which consists of our leadership team, and look at our core requirements, look at our 10 essential services. What are we doing? What are we doing well? What do we need to be doing? What shouldn't we be doing? All of that. And those aren't decisions that I make unilaterally. Those are decisions that need to be made by a group such as this. Okay, well, if there aren't any other questions, thank you very much. I appreciate your time, and I'll be doing this every year. I wanted to do it earlier in January, but I wasn't feeling well. I got sick over Christmas, and I came back and it was still hanging on. So I'm hoping to do this the second week in January every year so that I can give the script to the Board of Health at their meeting in January. So the script, and that's why I read it, because I wanted a consistent message. The script will be posted on the website and on the intranet as well. So if you want to read it again, or any of your coworkers that didn't get to see it, you can let them know. Okay? All right, thank you. Have a good weekend, everybody.
Thank you.